Tonya Ridley, and I'm a physical therapist here at Tulsa Bone Joint. I'm going to be going over with Tom here today some post-op instructions for his total shoulder that he's getting ready to have. So Tom, you're having surgery on your right shoulder?
That's correct.
Okay. So the main thing we want to go over is maybe some things that you would experience after surgery to kind of ease your mind so that you can practice doing stuff before you have surgery.
Okay.
So Dr. Dukes, after surgery, doesn't want you to take your arm out to the side at all. So you want to be careful. Now you'll be in a sling right after surgery, okay?
Okay.
So you're going to have that sling on most of the time. You're going to sleep in that sling. So he will have you get out of that sling to do exercises and shower. But other than that, you're going to stay in this sling.
Okay.
So it's going to keep you bound down here, but we still don't want you reaching out for things. We don't want you reaching out to get a glass to drink, anything like that.
Okay.
Okay? Little things that you might think are okay, try not to do them.
Okay.
The other thing that's hard for a lot of people right after shoulder surgery is sleeping. So if you have a recliner, a lot of people find it most comfortable to sleep in the recliner with a pillow behind their arm, okay?
Yeah.
That way you're not all the way back and that shoulder doesn't fall out to the side. And it may take several weeks for you to be able to sleep in bed, so don't push it. If it hurts too bad, you're okay sleeping in the recliner. That keeps you from rolling around and getting on your shoulder, okay?
Okay.
The other strange thing that people have trouble with is because are you right-handed?
Yes.
So it's hard to do things with your left hand because you're not used to it.
Yes, it is.
So before surgery you might practice. You're going to be in that sling, so things you might not think about. Brushing your teeth with your left hand. When you go to the bathroom, using your left hand for your hygiene. You don't want to use that right arm to push yourself out of bed. So when you get up and down out of bed, practice keeping that right arm at your side and just using your left arm to push yourself up.
Okay.
Same thing when you're getting out of a chair. Don't put that arm behind you and push up for a while. I want you to use just this left arm, okay? So those are things that you can kind of practice, that you can get used to using your left hand when you're not used to using it. Eating, a lot of people don't realize it's hard to figure out how to eat with your left hand when you're right-handed.
That's true.
I know.
Yeah.
It's one of those you just don't think about.
Everything is different.
Everything is different, yes. So practice it before you have surgery and that will make it a lot easier.
Okay.
The other thing he wants you to do is work on these little exercises. So we'll send you home with some exercises that you're gonna do, and that will help a lot with swelling. So because you're in this sling, a lot of times you'll get a lot of swelling in that arm and your hand. Your hand will get stiff and swollen just from being in one position. So you'll have some ball exercises that you'll do to practice squeezing. You'll work on some wrist range of motion, and you'll work on some elbow range of motion, okay? So that's all gonna help keep this loose and prevent some of that swelling. Ice will be your best friend after surgery, and you can ice several times a day, 4 or 5 times a day if you need to. Keep it on your shoulder for about 10 minutes at a time, and then take it off, let it relax a little bit, and then you can do it again in a couple of hours. So every couple of hours you'll have the ice on for about 10 minutes.
Okay.
That'll help with pain control.
How often will you be doing the exercises?
These exercises you can do 3 or 4 times a day. So you'll be in that sling. You can do them inside the sling, or you can do them without the sling even, just to let that arm hang down. But you'll unbuckle the top part of the sling, and then you can squeeze the ball, and you can do some of these range of motion exercises.
Okay.
A lot of times people like to do them more than 2 or 3 times a day just because you're getting out and moving around. The first 2 or 3 days you're going to be in quite a bit of pain. So any shoulder surgery, it's hard to get comfortable. So just remember that. Whether you're sitting or whether you're laying down, trying to get in bed, put a pillow behind you just to kind of prop it up. That sling will help you, but if you have an extra pillow, that will help keep it propped up and in a good position to help keep it comfortable. Showering, take your sling off to shower. When you're in the shower, what you can do is kind of put that arm away from your body, and then you can wash underneath. Yes, so if you have a shower bench in your shower, you can put your arm on the shower bench and then lean away just a little bit to wash underneath.
Okay.
Or you can get one of those long loofahs. So you're gonna have to wash your hair one-handed. So the other thing is you wanna wear some loose-fitting clothing, okay? You're not gonna be able to reach around and put that arm in your clothes. A lot of people like to wear button-down shirts. So you will take and you'll put that arm in first and then put the other arm in. Okay? So practice that at home as well. If you don't have anything that buttons up, get something really loose fitting that you can put that arm in first and then go over your head.
Or something that zips.
Something that zips. Something that zips or buttons is the best. Tom, we've reviewed most everything. So you know you're not going out to the side with your arm.
Right.
You can sleep in the recliner with a pillow under you if you need to. Sleep in the bed, prop it up if you need to that way too.
Okay.
Practice all your hygiene left-handed. Get used to that. Wear your loose-fitting clothes. Your first post-op visit, Dr. Dukes will kind of go over the surgery with you and make sure everything looks okay. And then at that point, you know, they may send you back to therapy. You may continue exercises at home. Those are just a few things that you need to know before having your total shoulder surgery. Thanks for watching.